I've shown you that we can use deep brain stimulation to treat the motor system in cases of Parkinson's disease and dystonia. I've shown you that we can use it to treat a mood circuit in cases of depression. Can we use deep brain stimulation to make you smarter? Anybody interested in that? Of course we can, right? So what we've decided to do is we're going to try to turbocharge the memory circuits in the brain. We're going to place electrodes within the circuits that regulate your memory and cognitive function to see if we can turn up their activity. Now, we're not going to do this in normal people. We're going to do this in people that have cognitive deficits. And we've chosen to treat patients with Alzheimer's disease who have cognitive and memory deficits. As you know, this is the main symptoms of early onset Alzheimer's disease. So we've placed electrodes within the circuit in an area of the brain called the fornix, which is the highway in and out of this memory circuit, with the idea to see if we can turn on this memory circuit and whether that can in turn help these patients with Alzheimer's disease. Now, it turns out that in Alzheimer's disease, there's a huge deficit in glucose utilization in the brain. The brain is a bit of a hog when it comes to using glucose. It uses 20% of all even though it only weighs 2%, it uses 10 times more glucose than it should based on its weight. 20% of all the glucose in your body is used by the brain. And as you go from being normal to having mild cognitive impairment, which is a precursor for Alzheimer's, all the way to Alzheimer's disease, then there are areas of the brain that stop using glucose. They shut down, they turn off. And indeed, what we see is that these areas in red around the outside ribbon of the brain are progressively getting more and more blue until they shut down completely. This is analogous to having a power failure in an area of the brain, a regional power failure. So the lights are out in parts of the brain in patients with Alzheimer's disease. And the question is, are the lights out forever, or can we turn the lights back on? Can we get those areas of the brain to use glucose once again? So this is what we did. We implanted electrodes in the fornix of patients with Alzheimer's disease. We turned it on, and we looked at what happens to glucose use in the brain. And indeed, at the top, you'll see before the surgery, the areas in blue are the areas that use less glucose than normal, predominantly the parietal and temporal lobes. These areas of the brain are shut down. The lights are out in these areas of the brain. We then put in the DBS electrodes and we wait for a month or a year, and the areas in red represent the areas where we increase glucose utilization. And indeed, we are able to get these areas of the brain that were not using glucose to use glucose once again. So the message here is that in Alzheimer's disease, the lights are out, but there is someone home, and we're able to turn the power back on to these areas of the brain. And as we do so, we expect that their functions will return. So this is now in clinical trials. We are going to operate on 50 patients with early Alzheimer's disease to see whether this is safe and effective, whether we can improve their neurologic function.